Hey guys, so this is a continuation of my petition for adding fibromyalgia as a qualifying condition for the New Jersey medical marijuana program. My camera stopped during question number 6, so I'm just going to pick up where I left off. While some patients with more severe pain take prescription narcotics, others only take over-the-counter drugs such as acetaminophen, Tylenol, and its generics. Many people believe that acetaminophen is a safe alternative to taking prescription narcotics. However, over 80,000 Americans visit ERs due to taking too much acetaminophen. Acetaminophen is now the leading cause of liver failure in this country, as stated above. Number 7. Describe the extent to which the condition itself and/or the treatments thereof cause severe suffering, such as severe and/or chronic pain, severe nausea and/or vomiting, or otherwise severely impair the patient's ability to carry on activities of daily living. See attached pages. Fibromyalgia causes severe suffering that severely impairs the patient's ability to carry on activities of daily living. Fibromyalgia causes many severely debilitating symptoms. The hallmark debilitating symptom of fibromyalgia is widespread muscle pain and tenderness. Pain is usually felt in the muscles, abdomen, back, neck, and joints. Pain is often chronic and can be severe. The pain can be sharp or to a lesser degree more dull. Muscles may be very tender and sore. Patients can experience muscle spasms. Along with muscular pain and spasticity, patients may also experience joint pain and or stiffness. The pain that fibromyalgia patients feel can severely debilitate them. Pain may be severe enough that patients cannot attend school or work. They may not be able to enjoy time with friends and family. The pain may be so severe that some fibromyalgia patients are bedridden. For some fibromyalgia patients, severe pain is not only constant but can be felt at all times throughout their whole body. Along with pain of a more musculoskeletal position, many fibromyalgia patients experience neuropathic nerve pain. Their neuropathic nerve pain may be severe burning, stabbing. Their neuropathic nerve pain may be severe pins and needles, itching, skin crawling sensations, tingling, and or numbness. The neuropathic pain may also be responsible for heat and cold sensitivity. Along with musculoskeletal pain and neuropathic nerve pain directly from fibromyalgia itself, patients may also experience a heightened sense of pain levels. Pain levels from general, non-fibromyalgia injuries, i.e. a sprained ankle, will be magnified to severe levels. The pain levels directly from fibromyalgia will also be magnified. Patients may experience gastrointestinal issues. They may experience excessive gas, constipation, and/or nausea. The gastrointestinal issues may prevent patients from being able to eat properly. They may lose their appetite and become undernourished. Patients may also have anxiety, nervousness, and possible mood swings. Those symptoms may prevent patients from being able to enjoy things they once did, like going out to dinner, being in a large group for gatherings, i.e. birthday celebrations, etc. The anxiety at all may cause severe panic attacks in some patients, lowering their quality of life. Patients with fibromyalgia often have symptoms that they share with patients of chronic fatigue syndrome, also called myalgic encephalomyelitis. Fibromyalgia patients often have excessive fatigue and malaise. The fatigue that fibromyalgia patients may suffer can be just as debilitating as the fatigue that chronic fatigue patients suffer. It can be all-encompassing and unrelenting. It can make it so fibromyalgia patients cannot do the same activities that they used to, including, but not limited to, working, going out with friends, spending time with family, household chores, and driving. The fatigue levels may rival those of chronic fatigue patients at times, while still not being from chronic fatigue syndrome. Fatigue levels of fibromyalgia patients may also be low to moderate. Fatigue levels can and most likely will fluctuate, sometimes wildly. Patients with fibromyalgia often share another symptom with those of chronic fatigue patients. That is cognitive issues including brain fog, forgetfulness, trouble concentrating, and trouble articulating the correct words in correct settings. The cognitive symptoms can be extremely debilitating to fibromyalgia patients. Patients with cognitive issues may have less fatigue and pain symptoms but still are unable to work because of their inability to concentrate, articulate, their forgetfulness, etc. It can be very depressing if other symptoms are at low levels or have fluctuated down to low levels at a point, but the patient is still unable to be productive. Cognitive issues, however, may also be present in patients with moderate and severe levels of pain and fatigue. It is important to note that symptoms and severity levels of symptoms will be different in each and every patient. Number 8. Describe the availability of conventional medical therapies other than those that cause suffering to alleviate suffering caused by the condition and/or the treatment thereof. There are no prescription medications to alleviate suffering that do not also cause suffering in and of themselves. All the conventionally prescribed medications may have adverse side effects that can cause the patient to suffer, and while certain other medications can be prescribed to help alleviate the side effects, those medications also can cause their own side effects. That is especially true in the case of prescription painkillers. There are a few non-prescription medical therapies that are used with limited success. Most non-prescription therapies have little benefit in helping in the long run and do not lead to a patient being cured of their fibromyalgia. The therapies are cathartic, such as stress management techniques, meditation, deep breathing exercises, and graded exercise therapy if the patient is physically able to perform the motions. Number 9. Describe the extent to which evidence that is generally accepted among the medical community and other experts supports the finding that the use of marijuana alleviates suffering caused by the condition and/or the treatment thereof. See attached pages. The use of medical marijuana is extremely beneficial to the patients of fibromyalgia. Medical marijuana has been medically, scientifically, and anecdotally proven effective in treating chronic pain. Medical marijuana is effective in providing relief for fibromyalgia patients with muscular, joint, bone, neuropathic nerve pain, and/or any other pain associated with fibromyalgia. Marijuana has been proven effective in treating pain. Two cannabinoids found in cannabis, THC and CBD, are effective at lowering pain levels associated with acute muscle pain, acute joint pain, acute bone pain, neuropathic nerve pain, spasticity, headache, chronic muscle pain, chronic joint pain, and chronic bone pain. Both THC and CBD help in the management of pain because they activate CB1 and CB2. CB1 and CB2 are the two main cannabinoid receptors of the body's endocannabinoid system. CB1 and CB2 regulate the release of neurotransmitter and central nervous system immune cells to manage patients' pain levels. Medical marijuana has proven its ability to significantly lower pain levels in patients with neuropathic nerve pain and muscular joint pain. Medical marijuana has also been shown to help alleviate pain that has not been responsive to other treatments. Across the board, medical marijuana has been shown as effective. In one study, 80% of patients who used marijuana for their chronic pain reported an improvement. Medical marijuana is also an extremely safe treatment for pain. Even after a year or more of using marijuana for pain, patients were found at no greater incidence of adverse effects than non-marijuana users. Studies have shown that the use of medical marijuana is effective at improving sleep, depression, anxiety, physical function, joint stiffness, pain, and a quality of life in fibromyalgia patients. It has been shown that fibromyalgia patients treated with medical marijuana over a 7-month period experienced a significant pain intensity improvements and were able to reduce their doses of opiates. A study found that patients treated with medical marijuana for 4 weeks showed a significant reduction in pain and anxiety, while the placebo group showed no reduction. Another study reported significant reductions in pain and stiffness and an enhancement of relaxation and a feeling of well-being in fibromyalgia patients. Medical marijuana has been proven effective in helping sleep quality of fibromyalgia patients. Medical marijuana is effective against anxiety that some fibromyalgia patients suffer. Medical marijuana is extremely effective in reducing and removing inflammation, whether that inflammation is in the patient's brain, bones, joints, muscles, and/or organs. Marijuana is 20 times the anti-inflammatory power of aspirin and 2 times the anti-inflammatory power of hydrocortisone. In fact, medical marijuana is such a strong anti-inflammatory that the cannabinoids in it may be beneficial in stopping certain types of cancers triggered by inflammation. Oftentimes, fibromyalgia patient pain may be deferred from inflammation. Cognitive issues in fibromyalgia patients are almost always the result of inflammation. THC and CBD are responsible for reducing chronic inflammation and curtailing the pain as a result of said inflammation. THC has been proven to reduce the development of atherosclerosis, a chronic inflammation disease that is a major risk factor for strokes and heart attacks. THC has also been proven to lower the inflammation caused by the flu. Those two findings show that THC is beneficial in helping fibromyalgia patients because, as stated above, one of the symptoms of fibromyalgia is inflammation of the brain. THC has been proven to reduce the development of atherosclerosis, which is a chronic inflammation disease that is in part targets the brain with strokes, so it will also reduce inflammation in the brain from fibromyalgia. CBD has been proven to reduce joint inflammation. Joint inflammation may be one of the causes of joint pain for fibromyalgia. THC and CBD decrease the production and release of pro-inflammatory cytokines and decrease the activation of the LPS-induced STAT1 transcription factor, a key factor in some pro-inflammatory process. CBD also reduces the activity of the NF-kappa B pathway, which is a primary pathway regulating pro-inflammatory genes, and it upregulates the activation of the STAT3 transcription factor, which induces anti-inflammatory events. CBD assists in reducing inflammation by suppressing fatty acid activity, which then results in increased concentration of the anti-inflammatory endocannabinoid anandamide. Widespread inflammation pain is found in fibromyalgia. Medical marijuana has been proven in pain management. Cannabis is cannabinoids act upon the cannabinoid receptors CB1 and CB2. CB1 and CB2 are involved in lessening of pain associated with inflammation. Studies have shown that CBD is effective in reducing neuropathic nerve pain because it reduces the inflammation causing sciatic nerve constriction. Cognitive issues may be the result of brain inflammation, so when a patient uses medical marijuana, the brain inflammation will reduce or maybe even be removed, and then the cognitive issues can improve and possibly completely dissipate. Medical marijuana can also be extremely effective in treating any gastrointestinal issues a fibromyalgia patient may have. Marijuana has long been known to limit or prevent nausea and vomiting. That is because THC and CBD activate the CB1 receptor. Activating the CB1 receptor stops vomiting. CBD's effectiveness at producing anti-nausea effects may be because of its indirect activation of the 5-HT1A autoreceptors in the brainstem. So that's my petition for adding fibromyalgia as a qualifying condition for the New Jersey medical marijuana program.